I can. Yeah, I can see that.
So we were discussing the LP1. So the most
Yeah,
important one, it's no-brainer technique, the upper lip, linear threading, wet dry border. First do the body.
yeah,
2 entry points here, each side. So total 4 entry.
yeah,
Lower lip, medial tubercle, you give a bolus, and then laterally you can give linear threading.
yeah.
On each side you can do,
Fine.
right? Then second comes the border, white roll.
Yeah,
That
yeah,
has to be again done for 2 entry points each side on the upper lip, and
yeah,
three, one in the middle and one each on the lateral side on the lower lip. So total 3 entry points in the lower lip.
yeah. Got it. Yeah,
So each
yeah,
point 0.05 to 0.1 ml.
yeah. So totally in the upper lip border, how much are we using?
Upper lip border,
Yeah,
that depends on how much the lip requires. Like if the border is completely lost, then you will put at least 0.1 ml each side. 0.1 ml each point. So 0.2 each side. So 0.4 total. And if
yeah.
the only slight improvement required, then 0.05 is good enough on each injection point.
Yeah, so that will become 0.2 to 0.4, is it right?
Yeah, yeah. So 0.2 to
Upper
0.
lip 0.2 to 0.4. If it is well defined, then we need 0.2, and if it is not well defined, then 0.4
Right,
upper lip. And
right.
body, how much are we using?
Body again,
Total.
0.2 each side, to total 0.4 in the upper and 0.4 in the lower.
Yes,
Like
fine,
each 0.1, 0.1, 0.1, 0.1, like that.
fine. Yeah, okay. Yeah,
So first we'll do the body, then we'll do the border.
fine.
Cupid's bow, I said very rarely it is required, because once you have done the body, it improves on its own. The maximum that if ever it is required, then just little bit, very less, even not even 0.05, even less than that.
So when you are doing the Cupid's bow, do you put in the shape of M or
Yeah.
you put it some other shape?
So you
Is it
inject.
okay to put in the shape of M?
Yeah, it's perfect. That is how it will, become even better.
To M shape. Cupid bow is given like an M shape.
M shape. So you make the entry point over here at the junction of the
Yeah,
filter column and the lip. Come medially,
uh,
then start
yeah,
injecting and withdraw the needle like this upwards. So the angle of
yeah,
insertion of the needle is going to be like this.
fine.
Okay. So products of choice is the same. Then lip border that we've already discussed, it will give structure to the lip border, and indirectly it will decrease the perioral lines. So if you have perioral lines, so you cannot do
Yeah,
perioral lines without doing the border. So if you do the border first, the lines will automatically improve. Like I said, if you do the body of the lip, the cupid bows improves. So similarly, if
yeah,
you do the border, the perioral lines will improve on their own. The lower half the perioral lines will be improved.
yes, got it. Yeah,
Yeah. So this is like this. Lip border we've done. Medial tubercle we are not doing. It's not required usually. It looks very odd if you do. Although it provides projection of fullness to the medial tubercle, but in Asian lips, I don't think any, medial projection is required. So some cases where they have M-shaped lips,
yeah,
so they are very difficult to handle. I will discuss the technique in later videos if you want.
yeah,
Tubercle, then we have the lateral tubercle. So this is how I was saying, you inject from beneath. When we are doing the vermilion body for the tubercles, so you pinch and then you inject from beneath. So you make a tubercle like this here.
yes,
Some people, instead of, if they don't want to pinch, what they do, they give a thread to the patient to, hold it between your teeth, and then between the teeth and the chin like this. So the medial tubercles become more prominent, and that is the area where you inject, just to anatomically surface out that area.
got
Then
it.
our technique is hold a earbud or something like that, like this, press it, so the tubercles will be enhanced, and that is the area where you inject.
Yeah,
So this again,
So one thing is in the lower lip, we deliberately want to create a depression in the middle part.
yes.
Upper
That is
lip, we want
how,
to create a projection in the
yes,
upper lip so that the two lips get locked. The
yes.
upper and the lower get
Hmm.
locked like that.
Yes.
Yeah.
Fine.
Yeah. Yeah.
So when you do this lips now, these LP 1, 2, 3, 4, don't get confused. First, just see the body first, then you see the border, and then the oral
Yeah.
commissure. Last is the oral commissure.
Yeah.
So in the oral commissure,
Yeah.
again, this product of choice is same. Volume is 0.05 to 0.1. Device is either needle or cannula. Usually it is, if you're doing marionette also along with the oral commissures, then you can use a cannula. Otherwise, needle is also fine. The delivery is
Yeah.
basically linear threading or fanning. And it corrects
Mm.
the downturn corner. So most of the individuals you see in whom we are dealing with oral commissure, they'll be bothered about the downturning of that corner.
Yes.
So they will always want it uplifted, upturned. So first thing
Yeah.
you is fill the this area. This is the downturn corner and the medial area
Yeah.
into the lower lip. There's a triangle which is forming over here like this. This triangle you fill with filler. So this gives supports to the commissure.
So the triangle is formed between the commissure and the lower lip.
Yeah, the triangle. See, the base of the triangle is the this line,
Yeah.
and
Okay.
tip will be somewhere here. So this is the hollow area which is created. So once you fill this area,
Yeah. So you give a bolus here,
fanning would be fine.
padding. And what is the entry point?
Entry point is somewhere here.
Okay.
Slightly medial to the marionette line. Entry point.
Fine.
So
Yeah.
there you have to
Got it.
do your threading.
Yeah.
Fine.
Yeah. Got it.
So once this is done, this will give support to the commissure.
Yeah. Yeah.
Okay, now it's not going. Okay. So this is how you give. Perioral lines we usually don't do, but if at all you have to do, you should not use ultra plus or Vollift. You can use Volite or you can use Vital for the perioral lines. This is basically hydration.
So how do you inject in the perioral? Like you just keep cross hatching or what?
No, superficially. Deep microboluses, superficially.
And they are not cross hatchings.
No. You just have to put, small bolus, just like we do micro botox or meso botox, no? Very small micro boluses of the HA given in this area.
So normally, how much ml is used in this perioral
There is no
wrinkles?
set as such, but it depends on how much filler you have availability and then divide each
Yeah.
in the 4 quadrants.
Okay. And the results are good. I've never worked with these perioral lines. Are the results
Actually,
good
we
with
don't
this?
have. The results are good, but mostly because in India we are not smokers now. Women mostly are not
Yeah.
smokers at the moment, Maybe 20 years from now, we will have females who will be having the smokers line. But at the moment, at
Yeah.
present, not many individuals or females have the smokers line. So it is usually not required.
Okay. Yeah. Fine.
So then we'll just cover 3-point marinate also.
Yeah.
Because whenever you do lips, usually we'll do lips in the end. The first, if you are given a face, the first thing you will do is cheek lift. Second, you will do
Yeah.
nasolabial. Then you'll do, marinate, then chin and jawline. And in the last, you do the lips.
Okay. Yeah.
So if somebody is having marinate lines and nasolabial folds, and they are just wanting to have lip filler, this will not, because the
Yeah.
lips will appear younger, and otherwise the
Yeah.
face has all the signs of aging. So there will be some kind of disparity,
Yeah.
which the individuals do not understand, but
Yeah.
you have to make them aware of it. Like if you do these concerns first and then lips later, it will give a better result. So we have M1, M2, M3, which is the upper marinate, central marinate, and lower marinate.
Yeah. Yeah.
Not able. Okay. So yeah, this is how you inject. It is always injected in the subcute. You are trying to uh,
Yeah.
fill the superficial fat pad. M1, M2, M3. This again, just like the nasolabial fold, slightly medially, it has to be injected in a linear threading. So at M1, M1, this is how you inject the triangle, this that I made. This is the M1, how you do. Then M2 is linear threading, M3 is also linear threading. At M1, you can do fanning in that triangle.
Yes.
So these are the techniques, M1, M2, M3.
So you're in subacute plane?
Subcute, superficial.
Okay.
And here
And
you
how
can,
much is that?
yeah,
Yeah.
can use voluma also
Volume.
or wall lift also. So either a needle or a cannula, 0.1 to 0.2 ml per entry point.
Yeah. Okay.
Right? Delivery is linear threading or fanning also. Structure is in the subcute. As such, no artery, but yeah, you have to be careful that labial arteries are somewhere around this area.
Fine.
Always
Okay.
inject medially to the labiomental crease.
Yeah.
That is the marinate line itself, slightly medial.
Yeah. 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 Okay. Now, one question regarding the labial artery, what I want to ask is,
Yeah.
like this is the lip. This is 4 mm from the border or 4 mm deep to the surface of the
Deep surface.
mucosa.
We are talking about the surface. So this is the lip surface, 4 mm behind it we'll be having.
4 mm deep to it.
Yeah, 4 mm deep to the surface, from the surface of the lip.
Surface of the lip. And exactly, we cannot point exactly. Is it in the
Because not
1 mm border?
everywhere,
Is it?
it is a tortuous artery, no? Somewhere it will be 3 mm
So,
behind the surface, somewhere it will be 2 mm, like that. But usually,
I think giving,
hmm,
yeah, giving horizontal injections is better rather than going but vertically.
yeah,
Sometimes inject vertically also in the lip.
yeah. Horizontal is always better. That's why I said linear threading.
Linear threading.
And
Fine.
always see, and when you evert the lip, you can actually sometimes see the veins. And if you observe them very closely, you can see the arterial pulsations also sometimes, in the submucosal plane. Also, it is very easy to inject senior or lips which are aged lips. In younger lips, you cannot see the artery and all. In the elderly, the place is chapped, and they are also pale.
Yeah.
So it's easier. I mean, I find it more easier to inject the senior age group lips, aging lips.
Yeah.
So this M2 and then M3. So chin and jawline we'll be doing in the next session.
Can we have it tomorrow?
Yeah, sure, we can
How
have.
are you placed tomorrow?
We can
Yeah, I
have.
like to have it tomorrow because then weekends become difficult. So
Yeah,
maybe we can have tomorrow.
yeah, we can have
So
the.
I'll ask Dr. Reena to make your payment tomorrow and we'll have it tomorrow.
Sure, sure.
One question I was thinking about, filler is the best way to activate your hyaluronic acid and put hyaluronic acid. But
Hmm.
what are the other things that can really stimulate your body to generate its own hyaluronic acid? Are you aware of any other substances
Uh,
that are applied topically and that can increase the production of hyaluronic acid intrinsically in the body?
See, what they say is that when there is some collagen induction, when you're inducing collagen induction, as a byproduct,
Yeah,
hyaluronic acid production also increases. So whatever is increasing the collagen production will ultimately end up increasing the hyaluronic content also. And body is producing and replacing the hyaluronic in the tissues every 24 to 48 hours.
yeah.
Right. So
So
anything which is inducing, so all the collagen induction treatments basically are also inducing hyaluronic.
you mean topically like vitamin C and I think
Retinol,
retinols.
retinols,
I
and then
came
all the,
across a compound called polyglutamic acid.
I don't have,
Polyglutamic acid.
I'm not,
Yeah, it is available.
yeah, it
It
is
is available
available,
in
but
the serum.
I don't have much experience with it.
And I was reading about it that polyglutamic acid is 5 times more powerful than hyaluronic acid to
Hmm.
hydrate. It is just like hyaluronic acid, but
Okay.
absorbs 5 times the moisture of hyaluronic acid.
Okay.
And it is much smaller molecule than hyaluronic acid. It penetrates much deeper.
So what are
It
the
goes
products?
much deeper.
How is it commercially available?
I
Is
show
it
you.
available in India?
Yeah, I'll just show you. I think because I was trying to understand. This is Earth Rhythms.
I
I don't know
can,
whether.
yeah. Acha, this is a topical thing.
Yeah, topical.
It's not
It is
injectable.
Earth Rhythms. It's not injectable.
Okay.
This is
Okay.
something topically you can use
Mhm.
because I was very much studying, how we can activate the hyaluronic acid uh, in long run in the body by naturally, without going for injectables.
See,
So I came
long
across this
term.
compound, polyglutamic acid.
Okay, so have you tried it?
I'm using it on myself.
Okay, so how does?
And I talked to my dermatologist. She was not aware. He was not aware of it. I said, study about it.
Mm-hmm.
Then he read about polyglutamic. Then he came said he has a lot of papers on it.
Mm-hmm.
It is available commercially on online because a lot of companies are making polyglutamic acid. So it goes inside and it works like hyaluronic acid and induces the formation of hyaluronic acid also.
Mm-hmm.
This is one compound which I am really, which I came across and which can activate hyaluronic acid
Okay.
also. And giving orally hyaluronic acid is
That is
also, this
that
is
is
one
good
thing
enough.
also that
Oral
oral
collagen and
hyaluronic.
hyaluronic acid will help whatever you are, all the
Yeah,
treatments. They'll supplement all the treatments. But I'm not aware of
yeah.
this glutamic. I'll just go through it if I can find something.
Go through it and
It's
just read about it and just let me know what is your thought about it.
Yeah, yeah, definitely.
And another thing is in moisturizers, there is something called pentavitine. Are you aware of the compound pentavitine?
Yeah, yeah, I'm aware of it.
Pentavitine has got a very special quality that it hydrates the skin for 72 hours, which no other moisturizer can do
Yeah.
because it locks the moisture loss for. So this is any compound having any moisturizer having pentavitine will have the moisturizing impact effect lasting for 72 hours.
I will have to.
And
What are the compounds available? How is it available commercially? That I'll have to check.
I keep searching on Amazon and various places with this.
Uh-huh.
So I don't go for the companies, the standard products which the big pharma companies are selling. So I got pentavitine also, which
Hmm.
is available.
Hmm.
72 Moist is the name of the product, which is called pentavitine. There might be present in other compounds also. So
Okay.
I'm working on this, trying something,
Hmm.
how it all impacts
Hmm.
the moisture of the skin, the quality of your skin.
Okay.
I'm doing one very interesting experiment. Calcitriol is something used
Hmm.
for psoriasis and it is vitamin D. But very
Yeah.
few people know there's something called calcitriol that's topically available.
Okay. Yeah. Even I don't know.
Yeah. Calcitriol is very strong, very potent. So we can't use it on first phase. But calcitriol is vitamin D3 topical, which
Hmm.
is available.
Okay.
And I'm using along with retinol calcitriol on face. And
Okay.
I'm finding it directly modulates your skin to
Hmm.
rejuvenate your skin.
Okay. So this is something
Because it is
interesting.
vitamin D. Vitamin D is really, it
Yeah.
works on the nucleus and it activates a lot of things.
Yeah.
So combination of retinol, there are three things which are coming in my study
Hmm.
that really work on the nucleus and very few people use them. One
Hmm.
is retinols, but retinols are very, very weak. Better
Hmm.
than retinol are retinaldehydes.
Hmm. Yeah.
Better than that is
Yeah.
tretinoin,
Right.
adapalene, and then it comes tazarotene. And
Huh.
now the latest is triferrotene, a cliff, which has come. for
Okay.
acne, the latest compound. So
Mm-hmm.
retinols is one group that really activates your everything.
Yeah.
The second group which really activate is urea, which nobody uses in the skin
No, no,
face.
I'm giving urea.
Especially
I'm giving urea to a lot of
giving
people. Yeah.
10% urea is very good. It
Mm.
really activates your moisturizer and everything. And third is calcitriol.
Okay. Calcitriol
The
on.
combination, yeah, calcitriol is available in the market,
Hmm.
but they use only for psoriasis. They're not aware that it can have many lot of other, especially people can tolerate it. It is very, very effective because calcitriol is like vitamin D, giving topically vitamin D to the skin.
Hmm.
So it makes the skin thinner. It makes the skin look better. It can
Thicker.
help in melasma,
Uh,
thinner.
it makes
What
the
happens
skin.
in psoriasis?
It.
Psoriasis, the skin become hyperkeratinized.
Uh-huh.
So calcitriol
Lactic.
with age, the skin becomes very thick,
Hmm. Hmm.
and it becomes skin very soft and
Okay, like
less
that.
thick.
Okay.
Yeah, even azotretinone people take top orally to make skin thin.
Hmm.
When we do rhinoplasty, sometimes the skin is very thick,
Okay.
sebaceous skin. So we
Huh.
give them a Accutrate or azotretinone orally to make their skin little softer and thinner.
For how many days is it?
And calcitriol can I give 10 milligram Accutrate for about 5 6 months.
Five,
And
six.
after rhinoplasty, the big problem is we can't do much on the skin. The skin is
Hmm.
very thick in
Hmm.
most people. Their skin become thinner and their result, then they feel the results are better with time.
Okay. Great.
Because anyhow, we can't do anything on the skin. We can only work on the bone and cartilage in rhinoplasty.
Yeah. So you mentioned about urea.
So,
So there is a completely product range called Uriage. It's a brand. All the products,
okay, urea.
yeah, Uriage,
Okay.
Uriage.
No,
So
I look at
all the products are, I think, urea based only in that. And
it's a
then
wonderful compound. Urea is wonderful according to my study.
yeah,
And I thought very few people, doctors are using urea in their prescriptions.
because products, very few products, only one or two brands are good brands which are giving urea in this percentage, and that too urea preferably is more, to deal with eczema, dryness, and all that.
Yeah, but it really activates your cells from inside. No
Mm.
other moisturizer can do that. It
Yeah.
goes into your nucleus, it goes into your cells. Even if you use it for few days, it
Mhm.
really changes your skin quality.
Right.
Urea,
Right.
which glycerin cannot do, which
Glycerin
other things can do. Hyaluronic acid alone cannot do.
cannot do. So
Yeah.
why is HA so hyped? I don't
No,
understand.
HA works. HA works. It's not like that. The problem with HA is it has a very high molecular weight. It doesn't penetrate inside your skin.
But now there's
It
one
it, it,
brand
it
which is giving, I'll just share. Yesterday only that person came. It is called, no, it's not in this. They have three different molecular weights in the same serum. And
yeah.
they said that it'll keep the, in if after using for 7 days regularly, the hydration and the moisturization remains for quite a long time, at least 72 to 2 hours. That is what they claim.
Okay. Yeah, you can share that brand tomorrow with me.
Yeah, I'll send the picture.
Meanwhile, you look into this polyglutamic acid pentavatine also.
I'll definitely look at.
Just study about it, and I think you'll really love it because you are into this thing.
Yeah.
And my idea is, even if we are giving them fillers, we
Huh.
should find a protocol which really rejuvenates your skin.
Yeah, yeah,
I know the company called Zenobaji, if
yeah,
you are aware of Zoe
yeah,
products,
yeah,
they're very expensive,
yeah.
but the results are really remarkable with those
I know I've
products.
used Awaji peels, and this brand was there with there was a company called Timpac. Uh,
Yeah, yeah,
they had the products from Awaji.
yeah. They're very expensive. 7,000 rupees. Each tube is costing 7,000 rupees
They're
or
very
8,000 rupees. Yeah, but I'm trying to understand what are they using, what are they doing exactly to get results, so we
expensive.
can reproduce it at lesser cost. So I
Yeah,
thought maybe we use this calcitriol, urea,
yeah.
retinols combination of polyglutamic
And
acid,
then there is,
which can.
the latest in is Bakuchiol. They say
Yeah,
Bakuchiol is,
Bakuchiol is like retinol. It
yeah,
is like retinol.
it is the
I
latest.
have not studied how is it working with how effective is it compared to retinols.
Yeah,
But
but it is very less
yeah,
irritable, very less irritant factor.
use Ecliph, try
Eclipse,
ferrotene.
fine.
The Ecliph is the latest one which has come in the market,
Hmm.
and it works on the gamma receptors of retinoic acid receptors, RAR. It
Okay,
is very less irritant,
okay.
and it is the latest, latest to come in the market. Ecliph. Very
Eclipse.
few people know about it. Ecliph, and it has
I'll,
come to India.
okay.
I
I'll go.
think Galderma is marketing it.
Is it? If
Okay,
Galderma was it, then I would have had already I would
you
have got
talk to them.
talked to
I
them.
think it's Galderma only which is coming with the cliff. You talk to them.
Yeah.
It's a new product. Okay. Thank
Oh,
you, Dr.
okay.
Baba.
Welcome. Bye. Thanks. Good day.
I think we should keep one talk in the end just on cosmeceuticals and skincare
Yeah.
after fillers.
Yeah.
I would be very interested what you are doing, what products you are using,
Yes.
how
Because
you are working on,
achieving
because
the
that
results
will
is different.
maintain the results.
Yeah, maintenance of those results is equally important. For how long can you
Yeah,
maintain?
I like, yeah, after finishing all this, I like to have one talk with you on that.
So before that, let me do all my research then.
Yeah. That after you finish all these
Yeah.
topics.
Yeah.
So that will be for that we do it, how to make the skin long term look better after fillers and Botox,
Mm-hmm.
and how to take a good care of it
Yeah.
according to you, what all you are doing. Okay. Thank you, Dr. Barma. Nice.
Okay. Bye.
Tomorrow then.
Yeah.
Okay,
Tomorrow night.
tomorrow.
Same time. Yeah.
Yeah.
Okay.
Bye.
Bye.